Hello all. So in this video, we'll be discussing some basic ideology regarding neoplasia. See, this word neoplasia, we can split it into two parts. The first part is neo, which means new, and the second part is plasia, that means growth. Okay, so in total, neoplasia basically means new growth. See, when we say neoplasia means new growth, it doesn't mean every new growth is neoplasia. Like for example, when a girl gets pregnant and she develops a fetus, right? So, do you think that is neoplasia? No. But even that is a new growth in her body. So, every new growth is not neoplasia. Neoplasia must have some special characteristic, and those special characteristics were well explained by Dr. Willis, who was a British oncologist. So Dr. Willis gave us a pre-molecular, like previous time, definition of cancer or neoplasia, which means an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with the normal tissues and continues to grow even after the cessation of the stimulus that evoked the initial response. Okay, so this is the definition of neoplasia given by Dr. Willis in the pre-molecular era. Obviously, we have got some new definition of in the modern era that we'll check out a bit later on. Now, let us try to understand this definition of Dr. Willis. See, it is an abnormal mass of tissue. Abnormal mass of tissue which has some special characteristics. Like suppose here is a boy, and let us suppose that on its face, suppose a new growth occurs over here. Okay, now to call this growth a neoplasia, it should have some special growth characteristics. First of all, this growth should be excessive. Okay, this growth should be excessive to the tissue from which it got originated. See, neoplasia can be in liver or maybe in the brain, or neoplasia may be in muscles or bones or anywhere in the body. But this new growth which is going to be labeled as neoplasia, the first characteristic is that it should be excessive. Okay, it should be excessive. Like, just take an example. Suppose this is a piece of skin that got injured, and suppose that injury, that wound, if we keep that wound very much clean, then what will happen? Then this surrounding cell, it will start to multiply, isn't it? They will grow and they will proliferate and they will ultimately fill up this gap of the wound. Okay, they will fill up the gap, and once this gap is filled, they will stop growing excessively. Okay, so they were growing excessively on requirement, and once the requirement is completed, once this gap is filled, then the proliferation will be stopped, isn't it? But the neoplasia, it grows excessively. Its growth is excessive to the tissue of origin. So this is the very first characteristic of neoplasia. Apart from this, there are still more characteristics of this growth, that not only it is excessive growth, but also it is an uncoordinated growth. Okay, it is an uncoordinated growth. Because when a tissue undergoes hyperplasia, like for example, what happens in hyperplasia? In hyperplasia also there will be excessive growth, but in hyperplasia there won't be uncoordinated growth. But in neoplasia, the growth is not only excessive, but it is also uncoordinated with the tissue of origin. Okay. Next, there is one more characteristic, that this growth must be persistent. Persistent means progressive, means not only it is excessive growing, means it is keep on growing even if you eliminate the normal growth mechanism of the body. See, our body has got certain mechanism. Like just now you saw, whenever there is any kind of damage to the tissue, then the tissue undergoes repair. the tissue cells will grow, and once they are done with repair, then they will stop extra proliferation, right? So it means that in our body there are certain growth control mechanism, like for example fingers of a small kid. Okay, and as the person grows, the fingers also grows, isn't it? Like normally your finger grow, they will not just keep on growing forever, isn't it? So of course it grows during the developmental stage, the tissue grows, but it does not grow forever, isn't it? There is a limit. But tumor, in case of tumor, it has this issue. Not only there is excessive growth, not only there is uncoordinated architecture of that growth, plus there is one more thing, that is this growth persists even if you remove the stimulus that initiated the growth. Okay, so it means in the body there are multiple mechanisms. Okay, there are multiple mechanisms. Generally I can relate it to cell proliferation. We have got two mechanisms. The very first mechanism is the mechanism that will initiate the growth, to which we call it as proliferation factor, and then we have got an anti-proliferation factor, and the balance of these two will determine the healthy proliferation of cells and tissues. Okay, but the problem with cancer cells is they don't obey the laws of growth control. Like for example, we have got a liver. It has got a normal size. Okay, the normal liver, if the liver is healthy, even the liver is normal, it will maintain its normal size and maintains its normal number of cells. But suppose if a part of the liver is damaged, then the surrounding cell, they will try to proliferate and they will try to make up the lost cell replacement. Okay, this is a normal thing. But if the case is the liver, if it is injured, it does not, it will grow in the normal fashion. But if there is a cancer of the liver like hepatocellular carcinoma, then it may grow in an abnormal fashion. Okay, so we say that once a cell has become neoplastic, they will start growing on their own. For this we use a word autonomous. Okay, autonomous. We say neoplastic masses are autonomous. Their growth is not obeying any rule. Okay, so this was a basic concept about neoplasia that was given by Dr. Willis in the pre-molecular era.